Hello, this is Dr. Wong here, and today I'm going to teach you all about pneumonia and how to treat pneumonia. Okay, so basically when you have community acquired pneumonia, let's say a patient comes to your clinic and they come and they breathe like this, and you think they have pneumonia. Okay, so basically we have to understand how a pneumonia happens. Okay, so basically pneumonia is basically when there is bacteria in the alveoli and it's causing inflammation. Now, how did the bacteria get there? Well, there's many mechanisms. For example, you can inhale the bacteria, or maybe it's bloodborne, or maybe you pissed someone off and they stab you in your lung. Okay, but the most common mechanism is when there is bacteria in your oropharynx and you expire it in. Usually, the immune system will fight it off, but if the immune system is weak, you cannot fight it off. So that's why it happens commonly in old people, because they cannot fight off the infection. So how do we treat it? First, we have to understand what is the main bacteria causing it. There is gram-positive bacteria such as Strep pneumoniae, Staph aureus. There's gram-negative bacteria such as H. influenza. There's Moraxella catarrhalis. And finally, there's also atypical bacteria. And these atypical bacteria are hard to kill. For example, Chlamydia pneumoniae, there's Mycoplasma pneumoniae, and there's also Legionella pneumophilia. Now, the most important thing we see here is that there's a mix of everything. So we want an agent that kills all of these bacteria. So what is the agent? Well, we have macrolide and fluoroquinolone. Now, before, fluoroquinolones were the drug of choice, but no longer first choice because they cause side effects such as joint pain, headache, and seizures. You will still see a lot of doctors prescribe fluoroquinolones, but macrolides are the drug of choice now. So for our outpatient, we're going to give them a macrolide. Now, which macrolide do we give? We have three options. Erythromycin has resistance and make patient poo-poo, so it's no good. Clarithromycin has less poo-poo, but it's a CYP3A4 inhibitor. Azithromycin has the least poo-poo, but no P450 drug interaction. So azithromycin is preferred. Now, we have to note that the macrolides can cause QT prolongation. So if the patient cannot take it because of QT prolongation, we can give doxycycline instead. Okay, let's go to patients that are high severity, or maybe they are high risk of drug resistance, or maybe they're being treated in the hospital. For these kind of patients, we're going to give them azithromycin plus a beta-lactam. Now, which beta-lactam do we give? If it's outpatient, we can give them amoxicillin. If it's inpatient, they're going to need IV medication. We should give them ceftriaxone. Okay. The reason why we give this combination therapy is to cover against any possible resistance to azithromycin. Okay, if a patient has beta-lactam allergy, we can give them a fluoroquinolone, no problem. But it's important to note that we can only give levofloxacin or moxifloxacin. We don't give ciprofloxacin because there's no gram-positive bacteria. And the main cause is Strep pneumoniae, which is a gram-positive. So that's why we need gram-positive coverage. Okay, now, there has been recent concerns about the increasing resistance of Strep pneumoniae to macrolides. So the NICE guidelines suggest that if the patient is low severity, give them amoxicillin. No need to have a typical coverage. So just focuses on Strep pneumoniae. Okay, so we can give amoxicillin 500 milligrams 3 times a day. Okay, now let's talk about what the patient can do to help them make them feel better, other than taking these medications. Okay, first of all, it's very important that the patient drink a lot of water. The reason why I say this is because water will thin out the secretion and help them to breathe better. The second thing is, if the patient is over 65 years old, we recommend the pneumococcal vaccine. So that's what we should do. Thank you for watching. I hope this was very helpful, and stay tuned for our next video. Let me ask you this question to see if you learned something.